So, in the intensive care unit of a hospital, the safe patient to nurse ratio is considered a 2-to-1 ratio, so two patients to every nurse. So, with that, that's pretty reasonable. A nurse can take on that kind of responsibility. Obviously, in the intensive care unit, there's a lot of things going on. Well, I want you to imagine what it would be like with an 18-to-1 ratio, 18 patients to one nurse. Obviously, it would be way too much for that nurse. It'd be extremely out of their scope and capabilities. It'd be very taxing physically, emotionally, mentally. And the reason I bring this up is because I want to relate it to the average consumption of oils in America. So that ratio is actually 18-to-1 as far as omega-6 to omega-3 ratio goes. And that's really a big cause of heart disease in America. And so when the safe ratio is actually supposed to be 2-to-1, 2 parts omega-6 and 1 part omega-3. And when they're that much imbalanced, say 18-to-1, that's when it starts causing issues in our arteries, and overall inflammation in our body goes up. So we really want to be cognizant of what types of oils we're consuming, because a big part of why that ratio is so skewed and heavy on the omega-6 side is because there's literally vegetable and seed oils in every packaged product. Any restaurant you go to, they're likely cooking with them, and they're very high in omega-6 oils, or omega-6 fatty acids, and they're also heavily processed with things like bleach and hexane, so bringing more toxins and inflammatory markers into the body. So how do we mitigate this then and get our ratios back into balance? 2 parts omega-6 and 1 part omega-3. Well, a good place to start would be to swap out your cooking oils at home. If you have any vegetable oils such as corn, soy, cottonseed, soybean oil, safflower, sunflower oil, canola oil, those are all heavily processed oils high in omega-6. So we can swap those out with better oils that are less processed and higher in omega-3 content, such as avocado oil, coconut oil, and olive oil. Those are all great ones to start incorporating in your cooking at home. As far as mitigating it outside of the home, there is a nice app out there now that's called Seed Oil Scout. So it actually shows you the restaurants that don't use seed oils in their cooking. And it's also best to get in the habit of looking at ingredient lists when you can. And if they contain processed oils like the ones I mentioned earlier, then I suggest not buying the product. Obviously, these things take time to get down. Eventually, you'll learn products that have better oils in them, and slowly but surely you'll work to a better, more balanced ratio in your body, and that'll work to mitigate inflammation and prevent heart disease down the line. So I hope that was helpful for you guys. Take care.